So last week we talked about the vaccine, and we saw that they've been studying this vaccine, and they got the vaccine to the point where we know that there's a 90% efficacy rate. But there's some other things that have to be done with this vaccine. And so that's what we're going to talk about today. Okay, so last week what we ended up with was we saw that the vaccine was effective. In fact, it was 90% effective. So we saw when they separated out the experimental subjects, or the people that were involved in the study, that over a 2-month period there were about 95 cases of COVID-19. There were only a few of the people that had gotten or received the vaccine were positive. So that evidence was pretty compelling in terms of the vaccine actually does work. But now there's some other things that we have to look at. We know it works. It's 90. When you do the math on that, we had 44,000 people involved in the study, and out of those 90 to 95 people that contracted COVID-19, there was only a few people that got the vaccine, that received the vaccine, that were positive. And so it does have a 90% efficacy rate. But there are some other things that have to be done with this vaccine. We know it works, and to put this thing into perspective, when you look at the influenza vaccine, that we get the vaccine every year, that we've been getting for years, that has about a 50% efficacy. So this vaccine that they've come up with, this messenger RNA vaccine, it really has a high efficacy rate, or it really works. But what are the other things that we have to look at? And that's what I want to talk about today, so that the people, the lay people out there, kind of know what is going on with this vaccine. The very first thing is, when we look at the vaccine and who the vaccine worked on, we don't know. Did the vaccine work on those people that were at really high risk, and if they contracted COVID-19, they were going to die, or they were going to be hospitalized? Did the vaccine help those people not to get COVID-19, or did the vaccine help people that were in that group? And we know about 80% of the people that get COVID-19 have mild to moderate symptoms. Did the vaccine work on that group? And if that were the case, not very interesting, because we want a vaccine that's going to cross-section from kids to people that are 80, 90 years old. And so we want to make sure that this vaccine is going to be effective, not just in one subpopulation, but in all people that it's used in. The second real thing that we have to look at is the vaccine. We know it works, but on the people that it works on, does it work to the point where it keeps the people from getting COVID-19 levels to the point where they would be positive? In other words, are people still, do some people still have like low levels of COVID-19, COVID-19 viral loads that could be contagious? We know they don't have it to the point where they're positive, because the vaccine, the people that got the vaccine, there was only a very few people that were positive. But even in the people that were negative, are there viral loads enough in those people that it could be contagious and spread even though those people aren't positive? That's a real important point. Again, that's another detail that Pfizer and this German company are working on to find out. Who's the vaccine for? Initially, they studied 16 to 65, around those ages, and then they decided to spread it out to take it from 18-year-olds to 65 plus. That was good because it's incorporating it's incorporating the whole span of life, the ages. And also in the study, they had about 30% of all different types of people from different cultures, different ethnicities, and so they tried to incorporate. But one of the things that has to be looked at was these. When you do these clinical studies, you look at these subcommittees. So in other words, how does the vaccine work on people that have diabetes? What does it do with heart disease? Patients that have that are on dialysis, patients that are have cancer, mild cancers that are treatable. So now all of those things have to be looked at before we start giving this vaccine to people. We have to know how it works on different subcultures and of people. The other thing, the other challenge with the vaccine, and I'm sure that you people have heard, is that this vaccine, in order for it to be stable, it has to be kept at temperatures below 97 degrees, or about negative 97 degrees Fahrenheit. That's really, really, really cold. That's not cold. That's not refrigerator cold. That's cold. And so then the challenge becomes when you go to places like India, where there places where the temperatures are high, humidity is high. What mechanism, what process do you use to keep the virus or to keep the vaccine stabilized in those conditions? And so again, Pfizer and this company are working very, very hard at trying to find out, can we get it at a higher temperature and keep the vaccine stable? The last thing is that who gets the vaccine? Who do we give it to? There's been a lot of talk about healthcare providers would be the first to get this vaccine because, and that makes sense that we're working with people that are positive for COVID-19. So we're definitely at a high risk for contracting the virus. But then we got to figure out, do we give it to people that have comorbid conditions? Do we give it to people at 65 and over, et cetera, et cetera? So all of these things, even though we have something that looks like it works pretty well, all of these details have to be worked out. And they have, the government has fast-tracked this process, because we know that typically to get a vaccine that works and we know that it's safe and it's effective and all of those things, that typically takes 2 to 3 years. And we've put this together in over 4 to 6 months. We've come up with this vaccine. So a lot of things still have to be worked out. We want to make sure that we're not going to be harming people. What would be worse than having this pandemic and all of the sickness and the death that people are experiencing would be to have a vaccine that would make things worse. We don't want to do that. And I believe that Pfizer and these scientists from Germany are going to come up and they're going to work all of these things out, and that it's just a matter of time that we'll begin to have this pandemic under control. If you like this information, hit the like button. If you want to follow us as we talk about COVID-19, and eventually we'll be talking about other disease processes, subscribe. Be a subscriber, and every time we put some information out there, you'll be dinged and you'll be up to date. Thank you again, and we'll see you next week.